accessed or at least that is documented and has available code in a repository so that the user can go and run it right now. So we need this aspect. So that's all I had. If there are any questions, I can answer them. I didn't want to get too specific about which pipelines are at what stage, but again, we are discussing this in one-on-ones with each data generation centers, but there are these general aspects that every pipeline will have to have, and I think the whole process again could be sped up if maybe this, you guys just take a stab for each release data set, take a stab at providing the appropriately annotated and described pipeline and share it with us.
Hey Mario, this is Terry. Can we have access just to your slide deck? You make it so clear that it's easy to share with other people.
Yeah, absolutely. Yes, we'll put a link on the wiki.
Mario,
right,
for today's leaving. Send me the slides. I can, it's easier to do it as a PDF, or so I will link it to the agenda, to the wiki, and also to the presentation site on the wiki, and then we can put it in the minutes as well.
Oh, okay. Thank you.
Hey Mario, this is Eric Sobey from Mount Sinai. Thanks. Presentation was great. That you did make that very clear. Maybe this is a discussion to have offline rather than with the whole group, but we're happy. I think with our mRNA-seq data processing, I think we're ready to sort of plug and play the way that you outlined it. Since as you know, we've presented this at the other meetings. We did this with Kai already. And she created these Docker containers that were able to reproduce our results. But the initial stage of that was just an implementation based on our SOPs and on the code, some of the scripts that we provided to her. So if there's like a holdup on ours in particular, I'm happy to talk about that separately and put you in touch with Yugong, who's our main sort of data analyst, because I think it's all like ready to go.
Yeah, that's great. And again, I assume that actually your particular pipeline would be released in terms of these containers. But again, even for that, yes, we can take it offline and discuss what exactly we would need to kind of reproduce them, right?
Exactly, right. Because it's one thing to have Kai reproduce it, right? It's another thing to have it sort of everything in the right package to meet the standards that you just outlined, right? So there's probably still missing pieces, but yeah, I'm happy to talk about that because that could be a initial sort of use case, right, of how we've done that.
Right. And it could be only a matter of documentation, right? That Kai basically outlines the steps, what containers to install, how to use them, and all these kind of things.
That might be all we need. Yeah. Okay.
Yeah.
So Mario, just briefly, so I think what we should do is you kind of said it a couple of times, but I think one action item here is really for as data is released, right, for everybody to kind of review the different pieces, and if they're kind of in a state in which they can be shared, including the actual code and some documentation about it and examples, like you explained, right? So we can make this one action item. The other thing I wanted to ask, given the timeline that Ružica showed earlier, maybe I'm not sure how clear this was to everybody prior to your presentation here, but maybe we can do the same, like for the processing pipelines, at least for the legacy data, right? That how maybe some goal, some timeline that we want to achieve in order to have all of this available, and then that could be a good guideline for each group by which time you would want to kind of look at this, right, and take a first look, which I think would be fairly soon. given the timeline that Tushita showed, right? So perhaps it would be good if we could maybe outline some ideal timeline by which you would like to take a look at the various different pipelines for different types of assays. And then we can put it maybe in the action item somewhere. Right? So because, it takes some time, right, to review those and look at examples and then get back, right, and say, oh, yeah, I don't understand this part. I need some, I can't, something doesn't work, right? It's probably not always the case if it just works perfectly the first time.
Right. That's I guess the experience that we have so far, right?
Have a kind of timeline for this.
Yeah. Well, so I guess we are in the process actually of gathering information on our own from seeing what for a couple of assays. And these are gonna go as a feedback to data generation centers. Maybe we can go an assay by assay, and depending on what is there right now, define these timelines, right? And define.
Yeah, so if you have the timeline from Tushita, right? It's fairly already outlined assay by assay, and then it would just be maybe when we have those meetings about the standards, right? Then we could maybe also address either in the same or just a subsequent meeting also the pipelines, because they're really kind of fairly related, right?
Right.
And I just want to add, this is Terry. One thing that I have found very useful and helpful, in particular for Neurolinks, is since we've got 3 different types of omics that we're trying to get all this data for in different types of pipelines, it's really helped me to do one and then figure out everything that went right, wrong with that one, and then apply it to the next one and the next one. So, for example, we're working on RNA-seq now. We'll get that finalized with you guys. And then we would fall into ATAC-seq because that's the next easy one, and then we would fall into proteomics. It's just easier for me to coordinate that way. And I'd appreciate if we could do that. If we can, I understand.
I think that is, at least partially the reason why we go by assay, just because it's simpler, right? We could, I guess, try to, come up with some comprehensive, really big picture, but I think it would take way too long. Probably we would need like, probably take us like a year or something, I don't know, to get all of this done, like based on how long it took to develop the reagent metadata standards, for example, right? So an assay by assay approach, I think, makes the most sense.
Cool.
And that's also like reflected in the timeline.
One of the things that was that maybe didn't transpire, and I was just maybe trying to suggest that once you provide process and release data, right? That means that you already have the pipelines and you know how to use them. You have the code. At this point, you should be able, I mean, not you in particular, Terry, but in general, right? You should be able to write a summary of what exactly is being done, right? And it shouldn't be too difficult either to have a documented script, or at least if we put ourselves in this frame of mind, knowing that this is going to be part of the data release, it may become a habit, right? That as soon as if you're using the script at the same time, it's going to be annotated, it's going to be documented, and it's not going to be a big leap to basically just release this information for us to see it and try to use it.
I think that raises an important point, which is, I think going forward, this will be relatively straightforward once we have sort of a standard list of fields and things we want to capture. I think it's going to be very challenging for legacy data, though. So I think we need to think about whether it's even feasible.
And Mario, to your point, I agree. It's just, for me, I'm wrangling basically 3 or 4 different sensors just to get that data. So it's easier for me to focus on one group, then focus on the next group, then focus on the next group. But I can certainly try to do some of it in parallel.
No, I agree. I mean, I understand that completely. So that's, as Stefan said, that's how we are actually also slogging through. So it's
not too different for us as well.
Right. It is, though, we are getting a little behind with these pipelines at this point, and it's just maybe as we go forward, at least that will be fairly much easier, as Liz also pointed out.
Alrighty, so thanks so much, Mario. I think this is great. I want to move on here and move to the broad presentation so they have enough time. Unless the other really urgent questions, but I would really like to give the broad group enough time. So thank you, Mario, so much. This was really helpful, I think, and it helps to put an overall framework, right? So everybody understands kind of the dependencies and what I guess the expectations are to fully release the data, annotate everything. So if you give the screen back to, or if the Marcel, can you get share your screen?
I think you can just grab it.
I think you can just go to the meeting, or to click start, and then you can just click share screen.
I cannot share because it's still
okay.
occupied.
Let me stop.
So if you're on the desktop app and you're, yes, it comes up.
Okay, so can you see my slide deck?
So I can only see the Apple menu, but not any slide, any visual, just black, and there's this menu on top. So maybe, now it comes up. Is it two screens, right?
Two screens, yes. So
yeah, that looks good.
So I'm going to be talking about Links 360, which is a project we are trying to complete here on the road. And I prepared a brief agenda for today's presentation, and it follows the standard format. So what are the project objectives, what we want to use this, the results for, what are our methods, and for selection of compounds, and what compounds we currently selected, then future plans, and probably the most important part is a discussion where I would like to invite you to provide your feedback, suggestions. We can do it online after this presentation, or you can email Arvind with your ideas. So this is unpublished work, so please do not distribute this outside of this forum. So the goal of this project is to create a set of 360 compounds, hence Links 360, that are representative for diverse mechanisms of activity to precisely modulate cellular pathways. And this project is part of a larger project we call Diversity, where we want to explore a diversity of mechanisms of activity and diversity of cell lines. And these efforts go in parallel, and we have some selection of diverse cell lines, and we will have the selection of diverse compounds. And just to stress this, Links 360 by design is not a chemical informer set. It's a biological informer set, which means that we are not constructing this set to find new hits, find new compounds, or expand a series of compounds in a certain direction. But we are using this set, we want to use this set to probe biological pathways. And I just prepared two potential use cases. The first use case is to selectively inhibit cellular pathways, for example, in an anti-cancer combination therapy with a drug of interest. So this is a schematic representation of how this could be executed. And you can imagine we have a compound number 1 here shown on the schematically as these inhibitory arrows, red arrows, and we can, using one of the Links360 compounds, selectively turn off or turn on a pathway in a cell of interest, in a cell line of interest. And then we can treat this compound with the cell with another compound that targets downstream pathway or a pathway that is parallel to our pathway blocked with compound 1. And then we can have an L1000 readout. What happened to the gene expression after this combined treatment? And the other potential use case is to study pathways and which of them are affected by gene mutations in rare diseases. Rare diseases are diseases with usually a single mutation in one gene. And the idea is that with Links360, we can probe which of the pathways is affected by the mutation. And here you can think of this when you look at the schematic representation, that we have a cell culture from a patient with a rare disease, and we treat this cell lines with CRISPR, and we fix this mutation. So now we have two batches: cells with the mutation causing the rare disease, and cells that have this mutation fixed with CRISPR. And then we treat these two types of cells with compound X that has a given MOA, and we get our L1000 readout. And by comparing gene expression profile, we can tell if compound X in case 1, where we have a rare disease causing mutation, is similar to its profile in the second case where we fixed the mutation. If these two profiles are the same, it means that MOA A is not affected by the mutation. If these compounds are different, if the profiles are different, it means that the MOA of compound X is the one that is affected by the mutation. So how do we select these compounds? And we have a fairly strict criteria of selection. So a compound to be a representative of an MOA, it needs to be part of a larger class of compounds with the same MOA. And these compounds need to be fairly robustly annotated by external sources. And also, all the members of the group need to give similar result in L1000 experiments. So we must be able to confirm their biological activity, and their biological activities need to be the same or similar. And the other criterion is that compounds that are selected as representatives of a given MOA should have high on-target activity and as low as possible off-target activity to facilitate analysis of L1000 experiment with Links360. So how do we select them? So how do we maximize on-target activity and minimize or find compounds with high on-target activity and low off-target activity? So you can imagine this is like a heat map from heat maps that we generate in CMAP that shows connectivity between compounds, which we can think of as a similarity in terms of biological activity of these compounds. And red color indicates that two compounds have very high and similar, very high connectivity, hence very similar biological activity. And white color indicates that these two compounds have very different biological activity. And we are looking here on the example of aurora kinase inhibitors, which is a class, a pharmacological class that we predefined using literature, and then we verified that all the compounds in this class seem to be fairly similar to each other. And now we can pick a representative of this class. And if you looked only at the smaller heat map on the left-hand side of the screen that shows pairwise connectivity and is labeled with on-target connections. This heat map shows connections between compounds within this group. And you could think that, okay, so what our representative would be a compound that connects to all the other compounds or majority of other compounds, and this would be the representative. But then we looked at connections of these compounds to other compounds that have completely different MOAs, and we call those connections downstream and off-target connections. Downstream means that those are consequences of perturbing aurora kinase, and off-target connections are consequences of compound having some promiscuity in terms of its binding. And the right-hand side of the heat map shows, it's a made-up heat map in this case. It shows how many strong connections each of the compounds in this group makes to other compounds with completely different MOAs. And you can look at the number of internal connections, and you can look at the number of external connections. And what we want is to maximize number of strong internal connections and minimize the number of strong external connections. And compound shown with the black arrow would be the best representative. It has it doesn't have the largest number of strong internal connections, but it balances the number of internal connections and external connections in the optimal way. And our procedure of selection is iterative, and I think I maybe go very briefly over this schematic representation, but basically what we are doing, we have some experiments. We have some L1000 experiments that we analyzed, and we were able to pick some representative based on the current experiments. But in some cases, we were not able to pick a reliable representative. And we devised this scheme, this iterative scheme, that we will select potential representatives. We profile them in 2 cell lines, in this case A375 and PC3 at 3 different doses. And we will verify if these compounds form a strong group or they connect to their group of compounds with the same MOA from prior experiments. If potential representatives connect to their corresponding PCLs, then we go to the next step, which is a step where we initially accept this compound as a representative. And in the next step, what we want to do is to see how this compound connects to other compounds that are already potential representatives. So in this way, we plan to maximize on-target activity and minimize off-target activity. If a compound interconnects to other compounds with different MOAs, with high connectivity score, we need to think about this as a representative. Maybe it's not the best representative, and we need to reevaluate the selection. And so that's why this process is iterative. And if a compound connects to its corresponding PCL and it doesn't connect to other compounds with different MOAs, then this compound is accepted as a representative, and it will ultimately go to our grand experiment, where we plan to profile all these compounds on the over 20 cell lines we have right now. And those are representatives that we already validated and accepted. And as you can see, there is some redundancy. For some MOAs, we have multiple representatives, but that's okay. We will ultimately refine this to have a single representative per MOA, but right now we are in the process of this iterative refinement. And all these compounds, they belong to a group that is strongly internally interconnected. And also all these compounds connected to prior experiments, which means we can not only validate their MOA, but we can validate their reproducibility. And all these compounds have as high as possible on-target activity and as low as possible off-target activity, which is our way of validating specificity of these compounds. And here you can see a matrix for this initial set of compounds, a matrix of connections. And what we would like to achieve is to have strong connections on diagonal, so compounds should find each other. I mean, a compound should connect strongly to itself, and a compound shouldn't have many strong connections off diagonal on this matrix. And as you can see, there are some spots that are off diagonal, but those connections are not surprising. Those connections are result of the fact that mTOR and PI3K pathways are interconnected. So it's impossible to perturb one without perturbing the other. So that's fine. We accept this. So in the last couple of weeks, we tried to expand the set of representative compounds. And we constructed new groups of compounds and validated them in new experiment that is being right now analyzed. We also constructed smaller groups with 2 compounds. In our original approach, we wanted to have at least 3 compounds to have some statistics about the internal connections in the group. But this way, we found we are limiting ourselves to really large groups of compounds with the same MOA, and there is no reason why we shouldn't look at smaller groups. And in the case of smaller groups with 2 compounds, we may need to use both compounds as representative of this MOA. And also, this is probably the most controversial part. We will try to collect all singletons, which are compounds with unique MOA. They don't form any group. There is just one compound. And we plan to validate these singletons against genetic perturbation. So the way of validating would be verifying whether a singleton with a given MOA and a given gene target gives a similar biological response from a treated cell as the genetic perturbation of a given gene. And our way of validating this would be, like I mentioned before, in this schematic representation, we accept a representative if it belongs to a strong group, here represented as a graph with nodes and edges. And a compound in blue is our representative. And we want to pick a compound that not only belongs to a strongly connected internally group, but also is reproducible in time. And compounds that we reject as representatives are those that are disconnected from their group, or they do not give reproducible gene expression profiles. And we used a new procedure that I just described, and we were able to add the additional group of compounds, in this case iteration 1, and the original selection was iteration 0. It was based on our prior experiment. Iteration 1 is based on the new experiments. And we were able to add the compounds for additional 51 MOAs. So we have coverage of over 80 MOAs. With the number of compounds, about 120, 130. This list needs to be still refined. So our future plans is to use genetic perturbations, whether shRNA or CRISPR, to validate MOA of the compounds with less common MOAs. And here we plan to take advantage of this extensive library that CMAP collected of gene expression profiles of genetic perturbations. And we also plan to expand our search for compounds to databases of chemical probes and chemical informer sets. And for example, chemicalprobes.org or CTRP here at the Broad The challenge here is that we need to be able to verify MOA of these compounds in L1000 readout, which is going to be our readout in the future. And we need to be able to either build groups of compounds with the same MOA or try to combine our genetic perturbations with these compounds. And then we plan to validate representatives on a set of isogenic cell lines where we know precisely, or more precisely, what pathways are affected and whether we can recapitulate this in the experiment. And my presentation is about to end, and this is the CMAP team, and all the members were directly or indirectly involved in this project. And I would like to finish my presentation with the final slide and invite you to a discussion whether we should use other methods of selection, whether we should expand to other databases of compounds, perhaps only FDA approved, and whether you have ideas for use cases how this Links 360 set could be used in other assays. And with this, I would like to thank you.
Thank you, Marcel. Great presentation.
Yes, please let me know if you have any questions. Or...
Are there any questions? I just want to mention one thing. On the data working group side, we have a section for Links 360. So perhaps even like feedback or questions or ideas could be added there. So the Links wiki, basically DWG wiki, has a section on Links 360, and we put a few a little bit of information there already. We can put this into the minutes, and so everybody has that.
Yes, so please see if we can discuss this right now. You can mail Arvin, or we can use this wiki page to share ideas about this. And once the Links 360 set is ready, we are happy to share it.
Yeah.
So Mark, this is Liz from HMS. I'm sorry if I missed this, but what is the final concentration that you're using for these drugs, and how is it chosen? I saw you had just a couple of test concentrations in the first round.
So we don't really have any concentration. Some compounds tend to be more active with very low doses and extremely active at high doses. But we decided to use these 3 doses that we have used. CMAP so far, which is 1 micromolar, 3 micromolar, and 10 micromolar. But of course, the final dose in the final experiment needs to be adjusted. Like, for example, FCCP compound, which is very active mitochondrial compound, has to be used at very low doses. Otherwise, it's very, very active.
So this is Avi from the DCIC. I have one question. Are you aware of this CREEDS resource that we developed, where we extracted gene, drugs, and disease signatures from GEO, and potentially that also could be used to identify more compounds and also look at additional, ways to focus the 360 onto disease signatures and stuff like that. I know you guys are doing similar mining.
Yeah. So I'm aware of this, and the major challenge is to verify if we can capture compounds' activity in our readout. So a compound could be very active in a functional assay and could be a perfect probe for functional assays. But if it has no reproducible biological activity in L1000, it might be not very useful to us. So that's one of the challenges. But of course, we are exploring all possible sources for new MOAs, new compounds.
All right, thank you.
you looked into how robust your 82 MOAs are to your process of discovering them?
Yes. So when you look at the past, you mean like internal connectivity between compounds with the same MOA, or reproducibility across different experiments? I mean, L1000 experiments, or all these compounds that we selected so far come from strongly internally connected groups, and they give reproducible signatures. So they are similar to the versions of their profiles from prior experiments. And we use our own measure. We have our connectivity score, which is based on an approach similar to GSEA. I hope it answers your question.
All right, thank you all. Thanks so much for the presentation. So we are beyond the hour, so I think we're gonna conclude the meeting. Thank you, everybody, and then we meet in a month. And I think we have a presentation from Kai Yi from the DCIC in March. Thank you, everybody.
Thank you.
Thanks.
Thank you.
Bye.